Hey everybody, it's Callie, and today I want to give you some tips on finding the right OCD therapist for you. I think it's super common for people to be a little bit reluctant, at least at first, to start to look for a therapist, probably for a bunch of reasons. I think one of them can be the stigma of saying to yourself, okay, there's something going on with me that I kind of need help with. Or sometimes it's that feeling of maybe like the devil you know is better than the one you don't, which I totally understand and is totally valid. I know that it can be really scary, and sometimes we get comfortable even in that discomfort of having something going on just because it's familiar and we know it. But what happens once we finally commit and say, no, I'm gonna do something about this, I'm gonna find a therapist, I'm gonna start trying to get better? What happens at that point? Once we've made the decision to kind of try to start getting better, we have another decision to make, and that is, who is the therapist that we are going to talk to? Who is going to be the one that's going to guide us through this process? And while there are so many great specialists and therapists out there, I think it's really important to note that yes, there is a therapist for everybody, but not every therapist will work for every patient, if you know what I'm saying. So today I just want to give you some of the tips that I think are important to keep in mind once you start trying to look for a therapist for yourself. First of all, I think it's really important when you're talking about a therapist that works with patients with OCD. There are a lot of specific things that go into treating OCD. So one of those things, of course, is ERP, or exposure and response prevention therapy, which I think it would be really beneficial, if you don't know too much about it, to do a little bit of research first into what goes on with that therapy and why it's special and why it's specific, and why we use it for OCD. Knowing a little bit about OCD and the treatments, and especially ERP, before you go into therapy can be really helpful, because you can find out if that therapist actually treats OCD, if they actually are using ERP, because there are a lot of specialists that say that they treat people with anxiety and kind of put OCD under that umbrella, but they're not using the, gold standard of treatment for OCD. You want to find out if that therapist is actually using ERP. So you can kind of treat your first meeting with that therapist like an interview. And there are some things that you can ask them to find out if ERP is actually what you're going to be doing. I've talked before in other videos about my experience with therapists or specialists that said that they treated OCD, but really they weren't doing ERP. They were doing other things, like they were doing talk therapy, or they were using other kinds of therapy, or they were misdiagnosing me, all of which, might have been well-intentioned and might have been what they knew, and they didn't have the experience that was necessary for somebody, for a patient with OCD. And again, it's all well-intentioned, and I'm sure that everybody wants the best for their patients, but a misdiagnosis or the wrong kind of therapy can really set you back. It can really kind of derail a lot of the progress that you might have made. It can really put things kind of on hold, because you're not doing things that are going to make you better. That you might actually be doing things that are kind of going to make you a little bit worse, especially if your therapist is doing some kind of talk therapy where they're trying to analyze and get to like the root of maybe something you have forgotten in your past is making you obsess over these things, or whatever it is, when really that's not going to be helpful for OCD. That kind of isn't really necessarily where any of those thoughts are coming from. Your brain is just latching onto these things that you think are important. So it's important to keep that in mind when you're talking to a therapist and seeing if what they're doing is ERP. And that's not to say that those therapies are totally silly or they don't work. For a lot of conditions they might work, but you're not going to see the kind of progress that you want to see with your OCD if you're not doing the proper treatment. So like I said, don't be afraid to do a little bit of research and have some knowledge when you go in, so that when you start to talk to your therapist, you can kind of ask them specific questions. You can ask them things like, am I going to be making a hierarchy? What's that entail? You can ask them about their experience with treating people with OCD. You can ask them what kinds of themes the patients that they've had in the past have had. And that will kind of give you a little bit of background on if this person has some experience in there, there and how many people they've treated. But it's important also, kind of like on the other side of the same coin, even if they haven't treated a ton of people, it doesn't mean that it won't be successful. As long as they're doing the right kind of therapy and administering it and you're following the directions. And another thing you could ask is if they're giving homework, because you should be getting homework. So as long as you're doing that homework and doing what they're prescribing, that's what you should be doing. The next thing that I want to mention is you want to make sure that this therapist, whoever it is somebody that you click with. It's somebody that you feel like you guys have a little bit of a connection, you have a good vibe going, because at the end of the day, you want to make sure this is somebody that you can really open up to, because what you're going to be doing is very personal. You're kind of going to be bearing your soul a little bit, I think, for lack of a better term, because you're going to be telling them things that are really upsetting, right? Like if it wasn't super upsetting, you wouldn't be looking into therapy. So it's important to keep that in mind, that you want to work with somebody that you feel like you can tell those things. And there are a lot of professionals, there are a lot of people that, again, they might be really, really knowledgeable. They might have a lot of experience, but you just don't feel like you're going to be a good fit. And that's perfectly okay. It's just like any other factor in your life, right? There are people that you meet every day. There may be people you work with. You're fine together. They do good work. They're, respectful. They're nice people, but you're not really close. Like you don't have that connection there. And that's totally fine. It's going to be like that with anything, so you can expect that you might have that experience with a therapist as well. So if the first person that you talk to ends up being somebody that you don't really vibe with, that's okay. You can try again, you can find somebody else, and it really is only going to benefit you to make sure that you're talking to somebody that you feel like you can totally be yourself, you can totally open up, and you can totally be honest about the things that you're feeling, that you can put words to those thoughts that you're having, the feelings and all the emotions and the impulses or whatever comes with them. You want to be able to really talk about that in depth, because these are all going to be things that are going to affect your response to therapy. And then another thing that I want to point out is it can be really hard to find somebody in person, that you're going to go to their office or you're going to be able to meet them in person and just, go through your therapy that way. I had a lot of issues with that way back when I started, because the whole telehealth and like virtual health thing wasn't really happening yet, because this was a long time ago. This was years ago. So it was really hard because there weren't really many specialists near me, and I really struggled with that. So that is where something like NOCD can come in and help. NOCD allows you to talk virtually with your therapist, which means you can do it wherever you are, which honestly really opens up the pool of people that are going to be able to help you. It really helps you kind of open up the pool of therapists that you have to choose from. So you can find somebody wherever you are that is going to treat you with respect and really listen and help guide you through this process of ERP and whatever else is going to come along with treating your OCD. No two people are alike, and of course NOCD understands that, so they will work to help personalize your experience and make sure that you are getting the therapy that you need to start to recover. If you're ready to give NOCD a try, you can go to NOCD.com or treatmyocd.com today, and you can start finding a therapist that works for you. And on that note, I'm gonna get going, and I'll see you guys next time. Bye.